Okay, I would like to thank all the speakers for their talks. It was quite a lot of subjects, and I would like to open the floor for a few questions. We also have to take care that we stay on time, I heard from the management. But I would like to give the floor, give you the opportunity to ask a question. Yeah?
I have a question back here.
Who's where?
I have a question. So marijuana is legal in half the states in the U.S., and I know as a Pompe patient, after a long week of work, a gummy on a Friday night helps take the edge off. So is there a reason, though, that we shouldn't be doing gummies or marijuana? I was going to ask Dr. Peters, but she's not here.
Do you want to ask the question? Because we also have a later session where you can ask open questions. Is there a specific person you want to ask the question to?
Yeah, I guess is there a reason? Is there anything that any reason why we shouldn't be doing marijuana?
I guess the main thing is before you go to bed, maybe reasonably safe, but during the day, it's going to affect your balance. And when people have a lot of balance issues, I'd just be a little careful about that. CBD seems to not affect balance or perception, cognition, et cetera. So certainly in the evening, I wouldn't recommend THC during the day. There is some evidence coming out that high doses of THC can impair satellite cell function, but there's none of that evidence for either the CBN or for CBD. In fact, CBD may actually improve satellite cell function. So keep it high in CBD and lower in THC, unless you're just going to bed.
So one other question?
Oh, I'm over here.
Over there?
Okay. Yeah. I would first like to say thank you for covering the topic of pain, because when I was diagnosed in 2015, I was being told pain was not associated with Pompe disease, even though my body felt like it was on fire all day long. I also appreciate the conversation about mental health as involved in pain. But she mentioned 2 drugs that I've been on since 2016 that she said may not be the best for Pompe patients. One of them I'm on because I also have trigeminal neuralgia. I've also had the spinal nerve block. I do have a pain specialist that I work with, but I'm just wondering why some of those drugs she mentioned, I thought she said were maybe not recommended. I'm on gabapentin and Tegretol, which I think was one that she mentioned. And they've worked quite well for me. But is there something I should be concerned about?
Do you want to answer this question? Yeah.
We see a lot of pain. So what's interesting is that if you look at the studies in patients with Pompe disease, where was the pain? Lower back, shoulders, and hips. And why is that? Scapular winging, just like FSH dystrophy patients, leads to instability of the shoulder, and you're more prone to subacromial bursitis, supraspinatus tendinitis. When you have lumbar lordosis, you lock your facet joints, so you get increased facet irritation, osteoarthritis, spinal stenosis. And when you have a waddling gait, you are putting, and I think Laura Case talked about this, your IT band is very tight. And
Mark, may I interrupt? Because I thought now the question was specific about the medication, why she should not use specific medication.
So the point there is depends on what's the cause of your pain. The drugs that you're using are excellent for chronic neuropathic pain, which is not very common in this disease, and trigeminal neuralgia is not related specifically. And so I think the key point is see a physiatrist or a neurologist, find out what's the source of pain, and then you can target the therapy. And I would just say that that's really important from a pain management perspective. And sleep is another big factor which seriously increases that chronic neurogenic pain. So good sleep is critical, which is relevant to everything.
Okay. One last question. Yeah.
One last. We have a question from one of our virtual viewers. Paloma Juarez asks, in regards to ketosis and ketogenic diets, with a number of parents looking to give our children as many opportunities to sustain independence and a life less burdened by challenges and symptoms of Pompe, and diet being an important factor in managing the disease, Are there concerns about long-term use of these diets, and what are the implications, if any, when using such diets during developmental years like toddlerhood, elementary ages, and even into puberty?
You should open it.
Yeah, I think that answer was probably best done by the neurology teams that have worked with people with pediatric epilepsy. And for example, like glucose transporter type 1 deficiency syndrome, there's a group at Hopkins that have a number of patients that have been on it for a decade, and some patients on for 3 decades, so 30 years on a calculated ketogenic diet, and there does not appear to be any atherogenic risk, but I think it's really important to do blood work, maybe even as much as quarterly, at least twice a year, to look at things like ApoB, and various atherogenic markers, triglycerides. If your triglycerides are going up on a ketogenic diet, that's not a good sign. So it's really important to look at cardiometabolic risk factors longitudinally. I think, if the diet is working, but the diet is not, it doesn't work for everyone. So I think you have to assess the safety of it and the efficacy of it over time with a neurologist, with a clinician.
Yes, and I also think that that's a very good point, because it's also quite a burden to do it for a prolonged period of time. And for epilepsy, it has been proven. And for this, it is still experimental, so that should be considered. I would love to continue the discussion, but I think I should stop here. And you can have questions during the break. And I think the presenters are open for these questions. Thank you very much.
Thank you.